In this video, you will learn how to construct the perfect onboarding questionnaire. Hi, my name is Liz. Don't forget to hit the little bell and subscribe to my channel to get future updates. Hi everybody. Today we're going to talk about the perfect onboarding questionnaire. So, creating an effective onboarding questionnaire for your private medical practice can help you gather important information about your patients, streamlining their initial visit and enhancing their overall experience. Here are some steps to help you create a comprehensive and informative onboarding questionnaire. Okay, let's start with determine the purpose and goals. So the first thing you want to do is clarify the objectives of your onboarding questionnaire, identify the specific information you need to gather to provide optimal care and streamline the patient intake process. One thing to really keep in mind is what kind of private practice you are. There are many different kinds of private practices. Some of them are more natural and holistic. Others are more geared towards allopathic medicine. There's also different types of Ayurvedic medicine out there that, open clinics. So depending on the type of clinic or the type of practice that you are, you do want to make sure to kind of cater your questionnaire to that specific niche within the private medical community. Some of the other things we want to look at is to keep your form concise and focused. And I'm actually going to show you an example of a onboarding questionnaire towards the end, and it's just a single page with very simple information. You want to make it easy for the patient to complete, especially because usually the demographic section of the questionnaire is just one aspect of your entire welcome packet or onboarding packet. So we want to, like I said, focus on those essential questions and information. You want to also make sure to gather your demographic information, which I'm sure everyone at this point is familiar with. So each demographic actually has certain things that they should be screened for based on that information. Age is another one. Certain ages are more prone to certain things as well. So make sure to get those things: name, age, gender, an address, so that if you need to mail them something, you can do so, their phone number, their email, different things like that. Whatever you're going to need in order to become their provider, go ahead and collect that information. Another thing we want to do is kind of set yourself up for success by addressing the patient's expectations. So you want to include different questions about what they're hoping to achieve for that visit. Ask them to discuss any specific concerns that they may have and ways that you as the practitioner can actually address those. Another great way to gather information is to just provide a blank piece of paper or an open-ended section. So me, for instance, I have a lengthy medical history, and sometimes there's certain things I want to highlight for a new doctor, new practitioner, and there's not enough room sometimes on some of the questionnaires. So I think providing just a blank piece of paper or a piece of paper with some lines on it where they can fill that out and write some concerns down is a great way to provide that space for them. You do need to make sure when you're writing things out that you are considering the language that you're using and making sure that it is extremely clear what you're asking them. Please do not include any medical jargon in these questionnaires. It's really easy when you are a practitioner, a nurse, a doctor, unlicensed personnel to use those words because it's something that you do every day. Once you get your questionnaire all completed, have someone else go over it, and if they have questions about what a certain word means, maybe you need to find a less jargony way to say it. So that's something else to consider. All right. Testing and revising. So when you do finally come up with your questionnaire, select a couple of patients, handful, maybe 5, and give them the questionnaire, and then tell them that you're testing this out for your practice and ask them if it's clear, if it's concise, if they understand it, if they feel like they've got enough room to answer the questions, different things like that. Another thing you want to do is consider digital options. I actually recently transitioned to a different provider, and one of the things that they did is they actually had me fill out all of my onboarding questionnaires online. And it was a huge deal for me. And the reason it was is because I didn't feel as much pressure at my appointment to, get everything right. You walk in, you've got all this information you've got to give them. That you are going to be meeting them for the first time. It can be a lot, especially if you're a chronic illness patient. So I really appreciated the fact that they gave me the option to complete it all digitally. And at a later time, we'll actually go over some of the different digital options options and which ones are HIPAA protected and which ones aren't. And speaking of HIPAA, HIPAA is something that is not an option. There's only one type of medical practice that does not have to adhere to HIPAA, and that's actually massage therapists. But if you do anything else, chiropractic, if you do natural medicine, they all are required to adhere to HIPAA, which of course is a very big deal. And so as you're preparing these documents, whether it's on, hard paper or through a digital system, you want to make sure that everything that you're doing is considered HIPAA compliant. And actually one cool little thing that you can do to make a clipboard HIPAA compliant when you hand it to a patient is you can just have a simple page on top that's turned over so that if Joe Blow looks at the clipboard, they are not going to see any of the health protected information. So that's just one way, even with paper, that you can actually keep everything HIPAA compliant. All right, so as you can see here is an example of the demographics section of an onboarding questionnaire. Extremely simple. Full name, date of birth, your marital status, your phone number. We're not trying to get a lot of medical history for this particular form. We're just trying to get their demographics. And so, yeah, it should not exceed one page. You can make your boxes a little bit bigger. I think these are kind of small. Do make sure to get some emergency contact details if something happens to the patient while they're in your clinic. You do need to be able to contact someone. So things like that, again, very, very simple. And at a later date, we'll go over how to create these again in a digital format as well. Some of the ways you can create these for hard copies or paper, Canva is a great tool to use for lots of different things, graphics and things for your website, and also forms like this. You can also create it in Microsoft Word. It doesn't have to be fancy. The same with Google Documents. You can also use Google Documents to create a document like this. So that is the onboarding questionnaire. All right, so remember that your onboarding questionnaire should be seen as a tool to gather essential information while respecting the patient's time and privacy. By creating a well-designed questionnaire, you can optimize the patient's intake process, improve the efficiency of your practice, and enhance the overall patient experience. Get out there today and don't forget to document it, delegate it, and get it done.